all fertility treatments are stressful. Infertility in itself is a distressing experience, and it is okay. It is normal part of experiencing and coming
How to
out.
deal with IUI and IVF failures? It's not a pregnancy loss, but it's about failed attempts. Obviously, they still go through some trauma. So I want us to understand what it feels like, what they go through. All yours.
Okay. See, repeated failures are very challenging because every time you try, you don't expect that it will not work. And
Yeah.
there's a lot of investment in every cycle. There's a lot of emotional investment. There's a lot of physical investment, time investment, investment from the point of finances, investment, be it on the point of occupation also. Your routines get disturbed because here you are, you end up at the clinic for 6 visits. In IVF, you end up almost 20 days in a month. So there's a lot of investment. And that is why we say burden of IVF is quite there. It is equivalent to the real treatment.
Yes.
And the real treatment might get over, is the physical treatment, but the burden gets carried over in every cycle. So when it comes to repeated cycles, it will invite a lot of emotional turmoil and doubt regarding everything. That is the most challenging of actually undergoing a continuous treatment. The amount of burden that pours in.
Doubt about one's ability.
Yeah.
So,
where we will get there, what will happen, where is it going to reach an end point? If not this, then what? Are we at the right place?
Yeah. I'm sure their entire identity as a male and a female also gets challenged when they're unable to conceive despite trying repeatedly.
Yes.
And it's like not just a one-time thing, but it's like a disease. Every time it happens, you get a rush of feeling of anticipation and of hope. And then there's that failure,
Correct.
you are let down, and it happens time and again. Please tell us what a patient goes through during these emotions.
It's like, it's equated to be like an emotional roller coaster. Ups, downs, again, a hope that next time we will go up, we might, get in there. And then a sudden crashing down or realization that it is not happening. How much do you want to go in for a ride is something that the couple can't decide at times. They don't know, or they are not able to make those decisions because of getting emotionally triggered as well. And that is where what happens is that the fertility team has many specialists involved. Not just the gynec ops person, but the endocrinologist, the physician, the nurses, the andrologists, the embryologists, the counselors, dietitians, physiotherapists, the front office people, the financial advisors, all of these people involved, because they all come together to help the couple with this story. Sometimes the geneticists are also involved because a lot of genetic testing is required because of repeated failures.
Yes.
Miscarriages might happen.
So every month it's like a repeat of last month. Happiness, hope, and then for no fault of theirs, things do not go the way they wanted to go. And then comes the crushing blow and you're back to square one. And you're not sure whether you want to restart the cycle or not.
Yes, that is where the decisional doubt comes. So they may start in the treatment with a lot of zeal and enthusiasm. And the blow of the treatment is so much that they might not be able to endure.
Yes.
And the responsibility of the fertility care staff is to reduce that blow.
Sometimes for certain couples, they are in so much doubt about becoming parents that even though that might have been possible, they give up, saying it's not, they give up. Yeah,
it is okay. A lot of times, see, the doctor does understand that. So they themselves might give them a gap between cycles, saying that, okay, you just rejuvenate yourself, take a while, and whenever you're ready, we will come back to it.
One common thing that I've heard doctors saying to couples trying to get pregnant is, do not stress. Now, that's very difficult for a couple going through this journey not to stress. How do they manage it? Stress.
See, it's important to understand what is stress.
Okay.
All right. Now, what is the stress? Is it just a stimulus? Is it my response? Is it the environment? Is it the interaction? What is it?
What triggers your stress? And so you respond accordingly. Okay.
So if you say that it is just a trigger, otherwise I was okay, I never had this problem. Have you not had any triggers in your life till whatever, 20, 30? You would have had. So you would have responded to it as well. So see, stress is not a stimulus. It is an interactional series between a stimulus and the respondee. That is a response. If you help a person understand that stress is primarily centered around your response, that means you can change your response. That means you can adapt to any stressor. And that's how we are surviving after COVID. So it's a valuable thing. Parenthood is a very valuable thing. It is a very important thing. However, my response to when I want to get there and how I want to get there is still within my purview. It is not just the way the expert puts it across. What they mean to say is manage your worry and regulate your stress. See, the use and choice of words may be different. Don't stress is different. It's very invalidating. Don't stress. Don't worry. Don't think about these things. Eventually you will have a child. So it's very invalidating. It's very contradictory in itself. The statement in itself. One part says you don't stress. The second part says you will have a child. And then how will you plan and how will you have eventually because you're having the difficulty. So it's very invalidating that way.
So how do we tell?
How much you choose to think and plan and move forward becomes important.
So how do we tell patients going through this to manage their emotions? How much do we tell them?
See, some part you will be able to do it on your own. So you will see a lot of couples become resilient. After 3-4 cycles, they are not really that worried and that bothered. It becomes like an office procedure for them. They're not that anxious. It comes down after a couple of cycles.
Okay.
For the ones who can't, will be the topmost 20-30%. Best is to connect them to an expert so that they can outpour themselves, because it is not just IVF. It is the sense of not being able to achieve something, the frustration, the threat, the sense of failure, not being good enough, the unworthiness. That requires help.
I want to segregate IUI and IVF because IUI is more non-invasive and more pocket-friendly compared to IVF. So the weight is going to be different. Obviously, from a different angle, but obviously parents are parents. What would you tell somebody who comes to you with repeated IUI failure? What would you tell them?
See, firstly, what we usually go through is, as a reproductive psychologist, it's important to see the medical history of the couple, get back to the gynae, and then position the couple. Because there would be things that she wants to convey very clearly, which the couple is probably misunderstanding or not able to position themselves to in their anxiety and worry. So why is this particular treatment plan? What is the expected outcome? How much time? And what if this cycle is not working out? So a lot of times cycle the plan, we'll do 2 to 3 and then see, which means till 2 to 3 we'll hold ourselves up. Right? Because the single cycle success rate of IUI worldwide is not much.
Yes.
Different protocol, different countries, there are different means of doing it. There can be different candidates for IUI. Somebody suitable for IUI is a different candidate. Other technologies is a different candidate.
Correct.
So the treatment success is not more than 15%, 8 to 15%, depending upon a number of factors, multiple factors. Which means what? The failure rate is going to be more than the success rate, which means you have to be prepared for it.
Yes.
If your positions you can fairly well, you can prepare yourself for it. And then move forward.
Yes. And so what would you tell a patient who comes to you with that kind of mentality? I'm a failure. I'm trying to get pregnant, but I'm not able to. What do you tell them, ma'am?
See, it's not just a one-liner which hits them and pumps them out and motivates them. That's what I say. First is understanding the physiological background, seeing what the gynec has her in her mind, seeing where the disparity is. If the couple is able to adjust and accept the treatment protocols, then what makes the person feels like that? So it's in the psychological workup of a couple who is undergoing fertility struggle is in itself very long. That in itself is 5 to 6 pages long. It has multiple sections: relational, marital, occupational, personal, personality, past psychiatric history, habits, patterns, adaptive, maladaptive, many things are there.
And so
accordingly, they are taken ahead. It is just a symptom. Feeling a sense of inflated failure is just a symptom. But there may be a story behind it. You have to get out that story and then we manage it.
Now, the treatment might be the same for both IUI and IVF patients. However, for IVF patients, right, it's more money involved, more time involved. And for the woman, it's such a invasive procedure and there's so many side effects. How do we go about it?
Yes, but with all of that, we also barter more success rate.
Yes.
Right? So compared to IUI, you will have a single cycle success rate of maximum 25 to 30% also in cases. So suppose the couple undergoes a cumulative, maybe 3 IUIs together. That will give them average success rate of what, 30% over 3 months. That almost doubles in IVF. Because see, the couple is being monitored between cycles also. There are several biochemical parameters also involved. There are several embryological parameters being involved, unknown parameters being involved. So how much are you willing for becomes the question. If you can take that burden, if you're willing for that amount of investment, that's good enough. And that also has many protocols. Like a lot of times, donor programs are more promising than self-use of gametes and such kind of programs. So what is the couple more personally and psychologically comfortable with becomes the thing, because the success rate is going to be again higher for donor programs.
Yes.
Are you prepared for it? Are you willing for it? Have you adapted yourself to it? Emotionally and physically, then it's all right.
Yes. Now that's the success part of the procedure. I want to come back to the society and family pressure and the expectations. How do they deal with it?
See, there are 2 ways which usually the couples would adopt. Either they would seal their boundaries, they don't engage that much with their primary and secondary circles. And the circles also adapt to their levels of privacy and secrecy that they want to maintain. So the couple sort of encapsulates. They don't visit a lot of functions. They don't meet a lot of people. They don't want to engage in a lot of conversations where such things are coming up. And that is respectfully, mutually decided. It's all right.
Yeah, it's so
a lot of them might not even say that they are visiting doctors for treatments. So many cycles have gone off. Or they have, kept some embryos for freezing and they will be using it later. It might not be shared. Fine, it's a good barter choice. And a lot of times they are overpressurized.
Yes.
Which is the sad part of the society.
Yes.
But you see, that breaks down an individual and a couple. You cannot make a healthy family from a broken individual and from a broken couple. So the society and family needs to adapt themselves to it.
Yeah.
Usually turn to resources which are more supportive. So friends would be more supportive. Maybe office colleagues would be more supportive. So social support is anyhow required.
Yes.
So a lot of times what happens is we have couples saying that, please schedule our treatments in this way because we have a marriage to attend in the middle. We have guests coming over at home. 4 days, we have to go for a religious procession.
We are a very intrusive society. So for anyone who gets married, neighbors and aunts and uncles and family members, they start questioning them. So what we're saying is, it's totally okay for the couple to not participate in that kind of dialogue and to safeguard their family.
Right. So this is what it's very important to bring out and highlight that if we don't have idea over somebody's pain, then we might not be in a position to help them out of it, and we'd rather help them do it themselves.
Yes. And
stepping back is also a way of helping them.
Yes.
It's also a way of expressing concern and respect. Yeah.
Yes. So for the family, and obviously for anyone watching this, it's okay if the couple doesn't want to include you in their journey. They're doing this on their own, and you have to respect them enough as individuals and as a couple to step back and just watch. For our viewers who are going through IUI and IVF failures and who are in need of support, what is the one advice that you want to give?
How you want to sway through this journey, how do you want to get to the other side of the river is entirely up to you. You want to take a quick ride, a boat ride, you want to swim through, you want to drive, you want to sit in a boat, wait, think, watch, go back, decide to go forward. Everything is okay in this journey. So position yourself, speak to your doctor, take a second opinion with another specialist if you think so. Ensure that where you're going, the clinic is following evidence-based protocols. Be informed. ASRM, ISHA, WHO guidelines, ICMR guidelines, Australian, Canadian guidelines are out there. Read up a little bit from the patient resources, not the clinician resources. Read those resources, get informed, discuss it with your doctor, and have a clear plan. Position yourself. Pre-start.
Pre-start
means from the month of treatment, 2 months before, take care of your mind, body, diet, exercise, habits, relations. And then start your journey, because it's going to be planned, as the doctor says, for another 2 months, 3 months, 6 months, whatever is mutually comfortable for you. And always cradle a realistic amount of hope. That should be realistic, not unrealistic. The problem is people enter treatments with unrealistic expectations.
Yes. So in short, for patients who are going through IVF, IUI journey or going through the infertility journey, one, it's not your fault. You have done nothing wrong. It's just the way nature is working out. And secondly, it is okay to question your treating doctors also. You can't just say yes, sir, yes, ma'am, to your treating doctors because they're doctors. It's okay to speak your mind, question them. Nobody's going to say anything. And the third is to set realistic expectations for yourself, for your benefit. And family members, you don't have to know when they're going to the doctor, how they're going to the doctor, how their treatment progresses, because that's their journey, not yours. When and if they choose to say to you, it's the couple's decision, not your decision. Anything else that we need to add, ma'am?
Realistic hope. Always have it.
Yes. Realistic hope. The realistic hope.
God's plan, sometimes God's plan is better than our plan.
That's so true. And all the time, not sometimes. Because He is mightier than us. The